If the partisan challenge to this law had succeeded, millions of Americans would have had thousands of dollars worth of tax credits taken from them. For many, insurance would have become unaffordable again. Many would have become uninsured again. Ultimately, everyone's premiums could have gone up.
The Affordable Health Care Act is exactly what America not only needs, but must have in order to thrive and survive. Those of you who dare criticize what your president is doing and now bemoan the Supreme Court decision slamming back at all of those twisted enemies, shame on you once and for all. This is what the White House is touting at this moment in light of the SCOTUS call 6-3, knocking down another challenge to the law. Not what our next guest would call the truthful script. Let's welcome back the president and CEO of MD Save, an online marketplace for healthcare, Paul Ketchel. Paul, straight out, how steaming angry are you right now?
Well, I think when you look at the bill, Ed, and what's happened today with this ruling, there's just a lot of things that aren't really being represented accurately. In that last statement, you just heard the president say that had these subsidies been struck down, you'd see premiums go up. And in reality, we're seeing average premium increases across the United States that have already been set in place to go into effect 2016, January 1, of between 25 and 45% in a state. So you got to ask yourself, how many, what does the president consider premiums going up if 25 and 45% aren't a high enough number?
Paul, other than the premiums, and we've seen these and we quote them and we talk to them and we show them, but what are these supporters of Obamacare, the ones that are taking a victory lap right now, just like the president, what else are they really missing here? Where are the lies?
Well, what you're seeing here is if you look at those, there's 10 million people essentially who had subsidies. 8.7 million would have lost those subsidies had the Supreme Court ruled the other way. But if you look at those individuals who have those plans, over 70% of them are on a high deductible, somewhere $6,000 to $10,000 out of pocket. And they're qualifying for these subsidies because they don't have those that type of cash flow to pay for those premiums. So if you look at those individuals right now who are still going to be insured under these plans, they can't afford the care that they've got already out of pocket. I mean, what they really have is not the Affordable Care Act, but it's really Catastrophic Care Act, meaning that they really don't have any insurance until they pay $6,000, $10,000 out of pocket. And these individuals just simply can't afford that to start out with. So what you're seeing is this victory of these individuals not losing their insurance. It's really not doing much for them right now to start out with.
I hear so many people right now saying, wait a minute, this is giving poor people the ability to get health care. These deductibles, they're not always going to be this high. And every time I look at it and every time I talk to people like you and we look at the reality, I see a couple of things. One, this high deductible system, it's going to continue. We're going to continue to see more hidden costs. And is it just simply right to say it's not sustainable, Paul? No matter what you do, if this plan continues, it's got to collapse within itself sooner or later.
That's exactly right. That's the hard part about this victory lap that everyone is running right now. When you look at the model, there is nowhere in the entire system that the economics are working in favor of the consumer. You have premiums that have increased dramatically. You have high deductibles that have increased dramatically. You're having premiums go up again. Last month, we had the highest number of emergency room visits we've had in years, and that's because individuals who now have insurance but can't afford their out-of-pocket health care because of the design of these health care plans are having to go to an emergency room where they can get care for free and not pay for that compensated care. It's not free, but they can get treated, and now they're going to owe that money too. So what you're seeing is even adding more cost to the system. So when you look at it from the outside and you look at every sector, there's only one direction that anywhere the cost is going, and that's straight up right now.
Well, I only got about 20 seconds left. You deal in the healthcare marketplace on a day-to-day basis. Are you confident in looking the people right in the eye right now through the television screen and telling them your rates are going to go up and you better be ready for it no matter what the president says?
There's no question. It's already been the insurers have already reported to their state health commissioners the rate increases for 2016. We've already seen in like the first 25 states a 20 to 40% increase. So you can guarantee next year your insurance premiums will go up.
And just when you thought everything was working out, guess what, people? You've been hacked again. Paul Ketchel, MD Save. Paul, always a pleasure to have you on the show. Thanks so much for bringing us a little dose of needed reality.
Thank you, Ed.
All right. Obamacare survives another Supreme Court challenge. The Republicans swear they are not done yet. Let's continue to follow it. Rock on, true believers. Thanks so much for joining us. We'll see you back here Friday on the fastest 60 minutes of news. This is The Hard Line.